Hey everyone, this is Bruno from House of Falcone. I am here today finally with Mr. Dr. Robert Lin. How's it going, my man?
Great.
Yeah.
Good day, yeah.
Thank you to be here with me, and thank you for wearing my suit.
Yeah.
Your suit.
Yeah.
That's
you.
amazing. No, it's been a pleasure. Now, we were just starting talking about it off camera. So this is one thing I've been wanting to ask you, and I'd like to get other people to understand even more so all of the massive work and the big change and different in the industry of dentistry, right? Can you tell me a little bit more about what does that mean,
Airway dentist.
airway dentist? Yeah, what does that mean?
It's funny because I fell into this area. Like dentistry is like medicine, it's very broad. There's so many different areas, specialty areas, niche areas. So I literally fell into this back in 2013. So I didn't realize I had all these breathing and sleep problems till one of my mentors picked it up back in 2013. So I got the test done and turns out I had severe sleep apnea. I would stop breathing 54 times an hour in my sleep.
Okay.
Yeah, so I literally add up the numbers. I spent a third of the night choking, holding my breath.
Yeah.
So I obviously went through a long process to get myself fixed. And then, so it's impacted. It's a very personal topic for me. So it affected me my whole life growing up.
Yeah.
Finally got it fixed when I was in my mid to late 20s. And then now since I've slowly learnt about it, I've also done a couple of master's degrees since that time, did my research on sleep apnea. And then since 2018, I haven't been your regular dentist since 2018. I've pretty much been practicing this full time. So what I do is anyone with a breathing or sleep issue, I help them find and fix those root causes, because unfortunately in medical dental school, we're still at university, still learning how to manage symptoms and not really digging deeper and finding what the real problem is. So if you see a problem here, what caused that, what caused that, what caused that, I'm trying to dig all the way back to the very start.
Yeah.
So I can fix everything in one go, because I had to see 10 different people to fix my issues. So I have a team of over 10 people, different health professionals that I work with. So
I promise, I don't know if you noticed by my expressions, but you just blew my mind. This is definitely not the answer that I was expecting. That is absolutely so interesting. So you could tell the different even in your body language. This has really affected you when you were younger.
Yeah.
In what ways?
I can give you some examples. So I think I have pretty good work ethic. Growing up, I would train harder than everyone else to try and be better at sports. Even though I competed at high levels in, say, tennis, basketball, I competed at state national titles, I had a ceiling I could never surpass. And a lot of that was due to my fitness and breathing. Like, I could never play a full game. I could maybe last half a game to 3/4 at most.
Yeah.
I need to play in short spurts. I need to break really quickly. And then I guess one of the wake-up calls when I was 13 years old, the Queensland Academy of Sport came to my school, and because I was a talented athlete, it was, I think specifically, they were looking for people that might be suitable for their cycling program. They take kids, train them, and they end up competing at the Olympics, things like that. But I actually failed the tests. So
with the doctors?
Yeah, with the breathing, with all the breathing capacity, all like that. So
you couldn't...
I guess that was the first sign, but I didn't realize it till I was in my 20s what the problems really were, because no one could tell me. They would thought, maybe he had asthma, or they knew I had hay fever, some allergies, but that was probably it. That they didn't look any further. They were just like, look, you're playing basketball at a high level already. You're fine. There's nothing wrong with you. So.
And now, what is this doing to you now, knowing that you on the other end of that wall? What has changed in your life, knowing all of that, and maybe even have you been able to fix any of that?
Yeah. Firstly, going through my whole journey actually took 4 years, and I flew every month to Sydney to see the best people, the best doctors, to get myself fixed. So it gave me that confidence, that strong belief that, what could be achieved. And then I did more and more study on it. I traveled the world a lot of times to Europe and America, like a couple of times a year, to learn from the world experts in these areas. So I gathered their knowledge, and since 2018, that's pretty much all I've been doing, whether it's kids with sleep breathing problems, helping them grow to their, I call it the full genetic or maximum genetic potential. So they sleep well, breathe, which helps with their overall health, their brain development, lungs, heart, everything, so they can be the best that they can be.
Wow.
And then with adults who already have problems, I can give you an example. I literally had a good friend text me yesterday. Her dad just had some surgery to clear up her airways. he already says, oh, breathing's at least 70% better in just the day after getting out of hospital. Heart feels a lot better because when you can't breathe well, sleep well, there's so much strain on your heart and your lungs. So he's feel like a huge weight is lifted off. Yeah, so he's happy.
And someone, so do you operate on patients? Is that what you do as well, or you diagnose?
I'm more of you can call me like the super dentist. So people will come to me, I'll get some tests done first, and then I'll use my knowledge that I've learned from everyone over the years to figure out what are the problems, and not just that, but what's the most important thing we should tackle first, because doing it in the right order is also very important.
Yeah.
So yeah, I have a team of 10 different people. So for example, that operation, that was an ear, nose, throat doctor, but not just anyone. Again, doctors have their own specialty areas. So this doctor particularly, I think he was a Harvard graduate as well. He particularly operates on people with sleep apnea, with breathing problems. So so he was the right specialist for that patient. So I matched the right people with the right professionals they need to see. So that all comes into the knowledge that I've learned for over a past decade. Yeah, I feel old now because I only just realized recently that like I graduated 15 years ago. Time just flies. So, so
well, that is super interesting. I love the fact that, like I said, you went through something yourself, and you found through a lot of difficulties you had to find your own solutions, but then this made your own superpower and made you the person that you are today, and made you the person that can help so many people out there that they really need that, and it's impacting their lives in that level. Because not for a moment, as you were talking about it, I wasn't thinking actually you are like you're trying to make it into like competition, and you're trying to make it into Olympics or nationals or anything like that within the sport community, but you can't because you have the ceiling on top of you. Like I never thought of that. And then even just the fact that, or like for adults, what other things, even just not being able to breathe well, what other problems will cause?
For
heart, you talked about the heart.
It's big on the heart because, say for example, for starters, at least probably half the adults over age 40 snore, in particular men. So if they're snoring, it means there's a blockage somewhere. Firstly, we've got to find out where they are. What's causing that as well. Sometimes it could be, like broken nose is a common one. Or it could be just poor muscle tone, or sometimes in men, unfortunately, we put on weight. That's not good for us either. So
why are you looking at me when you're talking about it?
So that's one of the signs. So just look for the signs, snoring, or if they stop breathing, if they have symptoms like it's
sometimes headache or something.
Headaches could be from teeth grinding, and that's also could be related to a breathing issue. But things like brain fog, because if you've got low oxygen, you're not breathing well, your brain's not getting as much oxygen, and it's actually causing brain damage to children. And with adults, it's causing brain damage as well. They're getting brain fog. It's sad because recently, in the last year or two, I've noticed a lot of younger males, in particular in their 20s and 30s, they look fit and healthy, but they're coming up to me like, oh yeah, I can't forget, I'm forgetting stuff already at this young age. So it's quite alarming to me. So I'm just like, now it's because I've been through my own journeys and this growth process, it's given me like, that's why I just went, I'm all in. This is all I'm doing now since 2018. So speaking of competition, then I'm like, I'm not really, say, competing with other dentists, like general dentists anymore. I'm doing my own thing. And I started teaching as well in 2018. So I have my own education programs, so I can reach more people. So hopefully, I'm not only just educating the public, but also helping healthcare
professionals
raise their level of knowledge as well. So just really spreading.
And the type of education that you're doing for the healthcare professionals, is it something that can be given worldwide? Like would someone from international, like America, or can they apply any of this knowledge to their own?
Yeah, they definitely can. So firstly, the things I teach are not taught at university, so it's beyond university level. But obviously each country has their different laws, rules and regulations, but the concepts, the knowledge, the principles can be applied. So there might just be some little minor tweaks they need to do depending on their country's rules and regulations.
Of course. Yeah. But that is like super interesting that you can do that, because it's one of those things when it feels like you broke through your industry standards. It feels like you're creating this new wave of knowledge and understanding and education about the airways. And yeah, like you're changing the industry. This is incredible.
Because it's also something we take it for granted. Like, we're all breathing all the time, so we just take it for granted.
Yeah.
And it's not until you have a problem, then you're like, oh crap, I really need to look after my health. Oh, I'm not sleeping well. Like, it's affecting my mood during the day. I'm tired. I'm hungry because it affects hormones.
As you're speaking, I honestly believe that I have breathing problems already. I think I need to do something about it. So actually, what is the journey then? What is the journey for anybody that thinks they might have an issue with the breathing? So what would it look like to work with you?
Yeah, just looking for basic signs and symptoms. We can start with kids. If a child, firstly, a child shouldn't snore because their jaws, their soft palate, their uvula, that hasn't developed properly. So if a child breathes heavily in their sleep, that's considered like a snoring in an adult. If a child like sleeps with their mouth open.
How old the child?
Oh, like really at any age. Because
Could be even 4-year-old.
Oh, I even have specialists in a particular area if needed. If a child even a few months old stops breathing in their sleep, that can cause brain damage. So I have specialists that I work with that can even operate on kids less than 1 if required. It depends how urgent it is. So,
but when you do the surgery at such a young age, would that fix it, or is it more of a like a little bit of a patch and then something to be looked after later?
A little bit of controversy there, because some people say, for example, tonsils, adenoids, or turbinates in the nose, swellings in the nose, that grows back. I guess a bit of a misconception there is I always tell my patients, there's a saying, warn before you perform, that you do have to manage your allergies, because think about it this way. If you couldn't breathe properly through your nose, suddenly it's clear, and then you're getting all this extra air through your nose. Some people didn't realize they had allergies, so suddenly all these allergies come in, so they didn't realize they had it in the first place.
Okay.
And then if you don't address the allergies, then the nose, the swelling, the irritation can grow back, usually in 2 to 5 years. Yeah, so there's usually not just one thing that's going to fix everything.
Yeah.
That's why I have a team of over 10 people.
It's like taking care of it.
I know sometimes some things are less practical, or sometimes costs can come in the way. That's why it's not just important to know, firstly, gather information and knowing what experts I need to treat this patient, but also the order. Because, okay, if a patient, say, only has this amount of money, okay, then let's just tackle the most important thing first, give them at least a 50% improvement. That's already going to impact their lives.
That's already impact somebody's life.
The way I do my treatment is everything's like you do with your suits. Everything's customized. Everything's tailored for that person's needs, what they want, who they are. Yeah, so it's very important.
And how would that work? They will like contact you, and then do you have a consultation, a specific consultation?
Yes.
Or is it?
So unfortunately
Or is it more of they're your patient as a dentist, and then they also talk about this?
Yeah, I'm lucky enough that because I've been doing this full time since 2018, I've built my brand already. So my patients are mainly, I don't even need to market myself anymore. In terms, they're all word of mouth from patients that I've successfully treated, and from other healthcare professionals, because I obviously educate and they learn from me. So they just keep coming in. So usually, unfortunately, being a dentist working in a clinic, that's one of the limitations to my work, unfortunately. So they do have to, I'm based in Brisbane, so they do have to see me in one of the offices I run out of. And then from there, one of my goals at every consultation is, I can tell you literally one from last week. I had a lady come in, she was only about 30 years old and she had all these issues. But I just examined her, and within a couple of minutes, I told her 12 different things that were not right about her.
Yeah.
She's literally jaw dropped. Because that's one of my goals. Because with my knowledge, I can usually just look at someone, look in their mouth, make a few assessments, observations, and just know. Because in my education program, actually one of my modules is I teach over 80 signs and symptoms to look for in a consultation.
Wow.
That might indicate this person has a breathing or sleep problem. Yeah, I was shocked too when I was putting my course together.
Putting
I was
it
writing
together.
The list, and then suddenly I added it up, it was over 80. I was like,
oh my God.
Oh my goodness. So I guess I've learned a lot over the years from a lot of good people.
That is great.
Yeah.
And you're so young, you're so driven, motivated. What is the drive behind your journey in your professional career?
Yeah, unfortunately, growing up, I slipped through the cracks. So I want to raise the awareness and educate healthcare professionals so other people that are suffering like I did and that don't know about it, they don't slip through the cracks and get ignored. So they can literally, I'm not religious, so I believe there's one life, and I just want My goal is for people to be able to live their best life and be the best they can be. And that starts with being healthy, having good sleep, so you can tackle every day of your life full of energy and doing what you want to do.
Yeah,
So that's,
yeah.
it's given me that purpose. And so it's my obligation to really, teach as many people as I can. So it can hopefully slowly and change the way treatment's done.
Yeah, I think whenever, you just said it right in that moment, whenever you go from, I feel like I should do this, versus it is my purpose, it is my must, that's when the things start to change.
Yeah, like,
That's when, that's a big difference in I should versus this is my obligation.
and it's so important because without that, you say you just go to your regular job, but then after that, go home, have dinner, and then I'm working on what I need to work on, because that's what gives you that drive to keep going, and doing it on weekends as well. That's what differentiates the really high-level successful people from just an everyday
And that's
person.
what I was going to ask you. You're young, you're driven. There's a lot of entrepreneurs out there that sometimes they see your achievements, but they don't see what's behind door. And it sounds to me that you are going through a lot of work, a lot of push, a lot of motivation. So what is driving that part of your personal journey?
Yeah, one of my core values I recently discovered with one of my mentors, we went through our values, is actually growth. That's one of my strong ones. I guess throughout my whole life, I've always wanted to keep getting better and be the best I can be. I don't really like to look too much at competition. I feel like I'm always in a competition with myself. And then I guess the way I judge myself is, did I learn something new today? Then that means I grew, so I became a better person. That's another big thing that keeps me going.
Yeah, because I think and it's one of those things. Sometimes there's a lot of entrepreneurs out there. They trying to find a way to be the best version of themselves. So if you were to give like a little bit of a tip, like a few based on your own journey, based on your own experience, what should they look at to start getting bettering themselves today?
Consistency is one big thing. Consistency is important because if they want to go on this entrepreneurial journey, it's not easy at all. You can maybe hit one hurdle and you can just give up. Yeah. Consistency, so chipping down that wall, like consistent steps, and being curious. That's another one I've just come across recently. Staying curious, because staying curious is what opens you up to opportunities and meeting people, asking questions.
Yeah,
they're two
big ones.
Yeah, two big ones for me.
Yeah, I think like the way that you define being curious, it is probably the same, like a similar way for me, where it's about opening up your mind and like taking in from any encounter that you have, like what you need to take in and what can you apply from other industry to your industry. You can see what kind of real change can you do versus I'm gonna do the same that the person next door is doing and trying to make it better.
Yeah,
but
that's a really good one.
But sometimes like you can really apply like from other people's experiences into your own. And then the other thing, you defined it as consistency. I think from my understanding, it's very similar to grit, right? Like it's keep on doing it and keep pushing until when it happens. Because I can tell you that myself, like I feel like for the first 3 years of my own business career, I feel like I wanted to quit every week. Like every week there was a reason to quit. And then I remember the reason why I didn't is because I had that grit and that wanting to be better and to excel at what I was doing. But then at the same time, I had supporters. I had like my wife that was behind me every step of the way. And the one question that she would ask me every time that I would say that I want to quit, she would say, can you honestly say that you're giving it your best?
Oh, yes.
Oh my God. Every time that she would ask me that, I would say, no, I can't say that I'm giving it my best. And that will put me back in the game. Yeah. So that's one of those things that I think grit is it's not missing, but it's one of the things that a lot of entrepreneurs, they should look at, I think.
Oh, yeah. Definitely, like you mentioned, surrounding yourself with the right people.
Oh, that's a big one. That's another one.
It's so important.
I just started within a great network of people where we met.
Yep.
But you've been within your own circle from 2018 or
Yeah,
or 2019 or something like that. Like also that is a big one. Like to be able to network with the people that are they're striving to be their best and they have real life experience in business that puts them at their best. I think that's a massive one because I know that me when I started within my business journey, that wasn't even in my register to have a mentor. Like you spoke about mentors, like how important was for you to have a mentor in your journey?
Very important, but because when you think about it, especially, I guess a good one is that a lot of people can relate to is like sports. All the top level athletes, they all have a coach. But then as entrepreneurs, business owners, we don't think of it that way. When I realized that, so I've got a few coaches and mentors now in different industries, which is also very important because they have their own different experiences.
Yeah.
So it's what you don't know, and not just that, the introductions, the people that they know, that introductions will introduce to each other. So by one of our coaches, the impact that can have on your business, or as one of our coaches tells us, one person, one deal, one opportunity could literally change your life, your business forever.
Yeah. And I mean, I love that about the fact that you talked about introduction, because I know that myself specifically until like probably like last year or year and a half ago, I had difficulty introducing people to each other because I felt like
can't tell based on
because I felt I didn't know how, or I felt like I was pushing it or something. But the reality is, for any entrepreneurs out there, that whenever somebody asks you for an introduction, I feel it is more important that you do it instead of thinking how you're going to do it.
Yeah.
So it's more important that you just connect the dots, whether it is like a message, could be literally just a text. Say, this is a contact that I want you to talk to, send him a message. So something as little as that. Don't worry about making it too fancy. Emails, it can be an email, but it doesn't have to be super fancy. It's more important that you connect the parties that you do anything too difficult.
And that's important. It applies to business as well. So some people want to get the perfect logo, perfect website, but just good enough, it's just good enough. Just get it done. That's probably more important, to get the ball rolling, get the momentum going.
Yeah.
Yeah, because I'm predominantly like a left brain dominant. So I sometimes can get...
Are you? I couldn't tell.
I've learned through going to lots of events to,
let go of it.
Yeah, let go and be more open and approach people. But I would used to get a lot of what we call analysis by paralysis. You just overthink and then you just freeze and you don't get anything done, or something takes way too long when it should be much faster.
Yeah.
So that's something I guess a lot of maybe new business owners, young entrepreneurs may struggle with as well.
So actually, I mean, this is funny because obviously like we caught up to design your part of your new wardrobe. So what made it so like you weren't stopped by the analysis paralysis when picking the garments with me?
Firstly, obviously, an introduction was made. If I've seen your content on social media, you make really good quality Italian suits for even celebrities and our business coaches. So if it's good enough for them, it's good enough for me. And then when we obviously had our session, it's so systematic. Within 5 minutes, everything was measured up. You knew your materials. Like it was a bit overwhelming for me because I've never seen so many colors in my life.
Yeah, that's what I was going to ask you.
And not just that, the education that you provided. Oh, this pattern here, it's more welcoming, so people will want to actually approach you, more approachable. Other designs are, this is more powerful if you're on stage speaking, which I do a lot of as well. So it's the education I really enjoyed as well.
Thank you, man.
Like for me, growth. I really like learning new things. And then now since then, when I look at other people's suits, I'm thinking, oh yeah, Bruno taught me this and that. And what colors match well together. And
no, I love that, man. Really cool, Thank you. You're too nice. I think like this is something that not many people know about it, and it's one of those things that I always given it as a given, just because, probably because I'm in the industry and it seems so straightforward to me. But then it is true. Whatever you like, the color that you wear tells a story about who you are, and the patterns and the style that you wear tells another story about who you are. So whenever you are within the business industry, it's so important that especially if you're trying to have a branding, you're trying to brand yourself and have a personal branding that aligns to your business branding, I feel like it's so important that when you go out, you don't give the people out there a reason not to do business with you, or you don't give them the wrong impression, and the wrong impression really translate to not doing business.
Yeah.
I think that's one of the
Missing out,
things.
yeah.
Don't you think?
Yes, definitely.
I think yourself, now that we worked on some of these pieces, do you feel that your chance of representing your own brand and representing yourself publicly has improved?
Oh yeah, definitely. For starters, much more comfortable.
Okay.
The material is like lighter than any jacket I've had, and it's longer, so it's designed to fit me.
Yeah.
So comfort, and that's going to give me confidence, and
Yeah.
so to be myself, to approach people, and
Yeah.
having the right colors and patterns, hopefully will also attract a lot more people to me as well.
I think the cool thing is that we're both going to America. We're both going to this awesome big event, like it's a 5-day event, and we're gonna meet celebrities. We're gonna meet really the top 5%, top 1%,
Top 1%, yeah.
in the business world. And I think it's exciting, but then at the same time, I think presenting yourself and representing yourself in the best way possible, it gives you the tools to then really kill it in the room, right? What are your thoughts? Like,
It's
would
going to be
you?
a couple thousand people there, so anything to do to really stand out. Like,
Yeah. Do you feel like more in the position now to really stand out?
Yeah, definitely.
That's great. Look, if anybody would like to reach out to you and know more about, because obviously we had small time together, but you did touch on a few points. So you are the go-to man for the Airways. You are educating medical professionals all around the world and patients, and you work out of practices. So there's quite a few things there to unpack.
Yeah.
So if anybody want to reach out to you for any of the things that I just mentioned, how would they do that?
Yeah, so I've got firstly a couple of websites. My dental one, just www.drrobertlin.com.au. So it's got my locations on there if you want to see me as a patient. I've got a personal branding website as well. So it's just robertlin.com.au. And that's for the business side, investments, things like that. And social medias, I think my Instagram is Airway_dentist. I've got 2 pages on Facebook. A personal one is Robert Lin, then a Dr. Robert Lin one. And I've just started a YouTube channel as well. So
Did you?
yeah, so I've got, I think, 20, 30 videos up there now. That's all about education. So if you want to know, okay, what signs and symptoms or what should I look out for to know if I have a breathing or sleep issue, yeah, I've got a few videos on there. Yeah.
That's great. Now you tickle my curiosity. Give me like a little bit of what should I look out for if I thought I had a breathing problem?
Oh, a good one, for example, I'll give you one that's a lot of people ask me about. A recent video I put up earlier this year is about, I call them, in normal terms, we call them panda eyes. You know, the Chinese panda?
Yes.
With the black, if you have dark circles under your eyes, yes, that's in children, that's not normal, okay? In medical terms, we call that venous pooling. So the venous blood pools in this area. And that could mean 3 things. So firstly, allergies or hay fever. The second thing it could mean is low oxygen, especially in their sleep. Yeah, so they're not breathing properly. And the third thing is underdeveloped jaws, because if your jaws, this area, it's not developing properly, the drainage doesn't work very well in this area.
Okay.
So that's that's a big one. Like adults, unfortunately, is a little bit different. We often get eye bags. We might have been working late at night.
We're not sleeping.
Or you might have been partying the night before. So it's a different scenario with adults, but that's a big one with kids, because what I've found is that a few alarming statistics I've come across recently is, since COVID, which is only a few years ago, the kids with breathing-related sleep problems has gone up 3-fold. Yeah, so that's an article that was released just a few months ago. So and also because of COVID, a lot of us were locked down, and obviously being a health-related problem, a lot of people have been on their computers doing research. So I feel like in general, the world's population is a lot more health conscious now. I'm getting a lot of people just randomly messaging me, asking about these things.
Yeah. Now, I'm going to ask you one more question. If you could change something in your industry, something that hasn't been done before, what would you do? And if you need a moment to think about it, or if you have the answer, you can tell me. Otherwise, if you don't know, if you need a moment to think about it, I can give you an example for my industry, for example. The one thing that I know that I would love to change about my industry is probably that the people out there, they don't know and they don't understand what impact not presenting themselves at the very best has on their social, professional, and personal lives. So it's one of those things that, as an Italian, because I grew up in Italy, like for me, it was just within my culture. Like they teach all of this to us from when we're very little, and they teach us to express ourselves from when we're little. So when I was like a teenager or like even younger, like I had my own style and I would experiment and I would try colors, I would try styles and all of that to express my own identity in the way that will present myself. And that the massive impact that has is literally between being the cool kid on the block or being like amongst the people that have less attention, let's call it like that. Or sometimes it's also about knowing that you are recognized by the people around you, that you recognize in the person that you are, like in the person that you want to be represented as. And that is culturally, like growing up in Italy, that's how it is. But then when I came to Australia, when I came to within the professional industry, I can see that so many men and women, they just don't put the attention to it. They don't put that because they don't know what impact that has on their lives. So whenever I see like somebody that I work with and they'll renew like part of the wardrobe or even just with the one outfit, they look at themselves in the mirror and they feel like more confident, more powerful, like they'll feel themselves in the mirror. That's when I know that they get it. So they'll get it once they do it, right? Yeah. But the one thing that I wish I could change in the industry is really like that understanding that taking care of yourself and really presenting yourself in your best way possible, it does have such a massive impact personally, socially, and professionally. So that's one of the things for me. But
I totally agree with that. Like you feel good, you're confident, like even the way you walk, your posture, everything, it just changes.
Yeah. And the thing is that there's a lot of problems out there, and it could be mental issues, could be just literally professional issues where I have a ceiling, I cannot go over that ceiling, or I cannot do better than this. And sometimes all you need is a little push. And I know that seems silly because we're just talking about clothes, but then I promise you, like sometimes even that little push, that little extra confidence, that little extra thing, it's what makes you get one time, one deal, one opportunity, and it changes your whole path. And it's one of those things that I find it difficult to change it, but I'm trying every day.
That's big in Australia because like we have that tall poppy syndrome, that little push that you got to give to stand out. Because if you want to achieve a lot in life and be successful, we have to be able to stand out.
Yeah. So what is the one thing that you would change out of your industry? If you had time to think about it, you were listening to me.
I have a few little things. Firstly, I graduated 15 years ago, and I learned nothing about airway and sleep. So with medical, dental, any healthcare professionals, if that was in the curriculum, it's still not readily available. The research shows that maybe up to 3 hours of education in like a whole 5-6 year medical program. That's it. That's all they learn.
Wow.
So that's that. Also to learn how to find and fix root
causes. That is a big one, by
the
way.
Fix root causes and not just managing symptoms. And the third one is, I know it happens in some countries, but it doesn't happen in a lot of Western countries, is that working together. Say, for example, a dentist learning, they will work in a hospital. There will be all these other doctors, specialists, and allied health professionals. And if there was a tricky case, they could all just come together and talk about it.
Wow.
But we tend to just work in our own lane, do our own thing in Australia. That's the way we were taught at university. Yeah. If it's in the best interest of patients if healthcare professionals can work together to get the best result for them.
Wow, I love it. Task force. Medical task force.
I actually,
I did it.
When I talk about these healthcare professionals I work with, I call them my 10 healthcare Avengers.
Oh, I
So
love it.
we're saving the world. Yeah.
I love it. That's awesome. Man, it's been so incredible having you in my show. Thank you so much. And like I promise, like I wasn't expecting this interview. You blew my mind. I love how you really change in the industry already. And I love like your dedication. Promise, like you're such a good person. I can't wait. You should contact him. You should give a DM, all the websites, give him a call because it's well worth it.
Yeah, thanks for having me.
Thank you so much.
I can't
Thank
wait
you, my friend.
to start showcasing the suits.
I love it. I love it. Thank you so much.